Good evening. It's 9 p.m. here in Seoul. Thank you for joining us on Arirang Patients are at risk in South Korea with the nationwide doctor strike continuing for a second day today. Almost 9,000 trainee doctors, which is over 70% of the country's interns and residents, have submitted their resignations so far, and majority of them have left their places of work. Our Eun-hee begins our coverage tonight.
The nationwide doctor strike continued for a second day on Wednesday as they protested against the expansion of medical schools' quota by 2,000 to over 5,000 starting in 2025. Over 8,800 trainee doctors, or more than 70% of the country's interns and residents, had submitted letters of resignation as of 10 p.m. Tuesday, though none of them have been accepted. Out of these, 7,800 have not shown up for work. The total number of leave of absence letters from medical students announced on Wednesday was over 8,700 nationwide, or over 40% of the total. As about two-thirds of trainee doctors have walked out, medical services have been disrupted and patients are facing inconvenience. For example, at Samsung Medical Center, one of Seoul's 5 major teaching hospitals, 30% of operations scheduled for Wednesday were postponed. Surgical procedures at the Severance Hospital were less than half of the usual amount. The focus of large hospitals has shifted to prioritize critical and emergency care, causing outpatient appointments to be postponed, while some patients recovering from surgery were discharged earlier than scheduled.
My father had emergency surgery for colon cancer, so today I came to check on the results, but I received a text message asking for my understanding, saying that appointments might be delayed due to the high number of patients.
In a briefing on Wednesday, the government stated that protecting people's lives was a priority and urged doctors to immediately return to work and to discuss the medical student quota issue with them. To minimize disruptions to medical services, the government plans to extend the opening hours of public health centers and loosen restrictions on access to 12 military hospital emergency rooms. It has also issued return-to-work orders to a majority of the doctors who have walked out. To this, junior doctors are demanding the government backtracks on the plan to increase the number of medical students, while the Korean Medical Association calls its return-to-work orders amount to suppression. Eun-hee, Arirang News.